The Preservation Facelift. For years, facelifts have carried one drawback, and that is the fear of looking pulled or tight. This is a recent scientific publication regarding the concept of a preservation facelift. Now, instead of stripping away and stretching, it respects your natural anatomy and it keeps ligaments that usually stick the face down are released, which enables lifting of the natural soft tissues. Now, this is called deep plane or vertical facelift surgery. It causes less trauma to the skin, which means faster healing, less swelling, and results that look less effortless. Surgery has finally caught up with the idea of graceful aging. Deep plane versus SMAS facelift. The SMAS facelifts focuses on skin and superficial tissues. It does make a difference. However, the skin has a memory when it relaxes. The deep plane approach repositions the underlying muscle and fat as a unit. It doesn't just tighten, it restores the face to where it used to be. The difference is years of added longevity, a softer, rested, more natural finish, and it's why many actresses are quietly looking for the same look decades later. Now, I've been using this technique for some time, and I've customized my approach to give further a more natural recovery and also to speed up recovery and give a more natural result. Now, number 3 is the mid-facelift, and it targets one of the first giveaway signs, the cheeks and the nasolabial folds. By lifting sagging mid-facial tissue, eyes look brighter, the nasolabial fold is softened, and it contours the area. And unlike other facelift procedures, we can hide these scars. We can make them invisible, hidden in the hair. Now, sometimes it's given other names, including endoscopic facelift, ponytail facelift, and the recovery, well, it's far shorter than a full facelift. We can avoid any scars around the ears, and more women in their 40s, early 50s are choosing as a preventative step as opposed to a rescue mission. Additive blepharoplasty. Now, this is a very interesting controversy at the moment. In the past, all the surgery was about removal. Removal of loose skin, removal of fat, removal of muscle. However, is this an outdated concept? Instead of just removing fat and skin, we can now add volume with precision. I have used fat transfer in my eyelid procedures for over 10 years, and I remember at a conference in London at that time, many top plastic surgeons frowned upon adding fat in this area. However, they are now listening. Eyelid surgery isn't about subtraction, it's about balance. Number 5, non-invasive blepharoplasty. Now, reading this recent article in Optometry Times, what about if you could refresh your eyes without weeks of downtime? Some surgeons reveal devices that will do that, non-invasive blepharoplasty. And these use energy-based technology to tighten and smoothen the skin without any cuts in the skin. So many patients have come to see me over the years where they've tried these non-surgical eyelid procedures and they've been disappointed. Blepharoplasty surgery is needed as it gives them the results they wanted. Number 6, the new precision eyelid. Eyelids are really measured in millimeters, and the tiniest imbalance can shift the entire face. It allows surgeons to pre-design eyelid folds with unmatched precision. The outcome, symmetry, harmony, a natural appearance that doesn't scream surgery. I can tell you that in my patients, I measure the eyelid parts to 0.5 millimeter, and this is what it takes: precision, intricate detail. It's not about medicine, it's about micro measurements for the eyes. Number 7, the science of faster healing. Now, in the Science Tech Daily, there's something straight out of a science journal: senescent cells. Now, sometimes these are called zombie cells. They slow down healing as we age. Now, researchers have found a way to clearly use them as a compound called ABT263. The effect: skin that potentially heals faster, looks younger, bounces back, more like it did in your 20s and early 30s. Now, while this is still in research, the implication for post-surgical and skin recovery are huge. I use regenerative medicine, PRP, AMP, to enhance recovery, give more natural results, and these types of innovations are potentially the future in anti-aging medicine. The structural neck lift, instead of simply just tightening the neck and the skin, it addresses the underlying submandibular salivary glands, digastric muscles, underlying neck support. Now this layered work sculpts a sharper jawline. I've been using it for my patients for many years, and really it's redefining what elegance is in the neck area. Number 9, natural versus overdone. The loudest aesthetic trend of 2025 is actually about less is more, restraint. High net worth women and men are no longer chasing different. They want to look like themselves. They want to look rested, graceful, the best version of themselves. Now, surgical techniques are evolving to match this: preservation facelifts, fat grafting, subtle lifts. Now, this isn't about hiding age, it's about elevating. Number 10, early intervention lifts. Now, this is an interesting article looking at advanced cosmetic surgery. Facelifts used to be a late stage rescue, but not anymore. In 2025, more women and more men are looking to have surgery in their 40s. They're choosing mini or mid facelifts or preservation-like, compounding interest for your skin. The logic is simple: gentle innovations early mean less dramatic changes later. It's not about chasing youth, it's about protecting elegance.